With abortion banned or severely restricted in 18 U.S. states, abortion pills have now become the new battleground for the anti-abortion movement. In a story co-produced with the PBS NewsHour, Kaiser Health News correspondent Sarah Varney reports on a new lawsuit brought by a conservative Christian anti-abortion group that could end access to the medication nationwide.
As needed, stocking the counseling rooms.
At Whole Woman's Health in Alexandria, Virginia, clinic manager Shaylin Nada is struggling to find appointments for women coming for abortion care from nearby states.
We're kind of in this, half circle around the East Coast of states, including West Virginia, Kentucky, Tennessee, Georgia, South Carolina, and many others that have either completely banned abortion access or very much restricted it.
Many patients come here for medication abortion, which involves taking 2 pills. The first is mifepristone, which blocks the hormone progesterone and halts the pregnancy. The second is misoprostol, which induces a miscarriage.
Medication abortion is very common. I would say about every day that we see patients, we see about 10 to 15 patients who have a medication abortion.
Medication abortion can be taken up to 10 weeks into a pregnancy. About 5 million women in the U.S. and millions more across the world have safely used the drugs. They now account for more than half of all abortions in this country and are also used by OBGYNs to manage early miscarriages. Misoprostol was approved by the Food and Drug Administration in 1988 to treat gastric ulcers. But mifepristone, which was approved in 2000 to end early pregnancy, is now being targeted by anti-abortion advocates.
A lawsuit underway in this federal courthouse in Amarillo, Texas, could force the FDA to remove mifepristone from the market entirely. That would affect every state across the country, including those where abortion remains legal.
We are living in a post-Roe America.
The lawsuit was filed by an anti-abortion group represented by Denise Harley of the Christian legal advocacy group Alliance Defending Freedom. Harley claims the FDA's safety review of mifepristone was flawed.
The FDA has one job, which is just to protect Americans from dangerous drugs. It's caused great harm to women and girls. It's extremely dangerous, and we're asking the court to remove that chemical drug regimen until and unless the FDA actually goes through the proper testing that it's required to do.
12 leading medical organizations, including the American Medical Association and the American College of Obstetricians and Gynecologists, say these claims are untrue. Decades of research show the risk of major complications from taking abortion pills is less than 0.4%. They are safer than commonly used drugs like Tylenol or Viagra.
Whole Woman's Health Alliance.
At Whole Woman's Health, CEO Amy Hagstrom Miller says medication abortion gives women more control over their health care.
When you have medication abortion, part of the process happens at home. And a lot of people like that. They think it's less invasive. It involves cramping and bleeding and passing of the pregnancy, very similar to a miscarriage. And people can be at home with their loved ones and can sort of schedule the passing of the pregnancy around their work schedule or their childcare schedule.
But here in Texas, the lawsuit wants to put a stop to that. The Alliance Defending Freedom makes a number of claims, including that the FDA used the wrong process to approve the drug.
The FDA also pushed the drugs through a certain special provision that's supposed to be only for treating illnesses and only for life-saving drugs. The regulatory process was not followed.
In fact, mifepristone's approval was investigated in 2008 by the Government Accountability Office, which found that the process was consistent with FDA regulations.
It's hard to think of a drug that has been under more scrutiny than mifepristone.
Glenn Cohen, a Harvard Law School professor, is one of 19 FDA scholars who filed an amicus brief in support of the agency.
We don't think there's a problem here statutorily or medically, but it'd be very dangerous to allow a single judge sitting in Amarillo to essentially order a drug that's used by many women in America off the market all of a sudden just because he believes a particular argument that's being made.
But arguments unsupported by medical and legal consensus have found favor in Texas courtrooms. By filing its lawsuit in Amarillo, the Alliance Defending Freedom was almost guaranteed to draw Judge Matthew Kacsmaryk, a Trump appointee who worked in the conservative Christian legal movement.
It's part of a trend of conservative legal movement actors trying to get before Judge Kacsmaryk.
Elizabeth Sepper is a law professor at the University of Texas at Austin.
He's made statements in opposition to reproductive rights, linking up reproduction to the feminist movement and making anti-feminist statements.
So why now? Why is the conservative Christian legal movement striking now with these cases?
Prior to Dobbs, the right to abortion would have stood in the way of this lawsuit. But now the conservative legal movement feels empowered to go after medication abortion, but to then extend their aims beyond abortion to contraception, to PrEP medication to prevent HIV.
Federal judges in Texas have ruled that a religious objector can block a federal program from providing birth control to teens. And emergency room doctors must equally weigh the life of a pregnant woman and her fetus.
It's all part and parcel of a claim to restrict reproductive health care consistent with conservative religious beliefs.
Denise Harley of the Alliance Defending Freedom said the FDA needs to study whether mifepristone can be safely administered. But she says no scientific data would be enough.
But it's fair to say, given the beliefs of your organization, that you would not want to see this drug back on the market, though.
Oh, I would not want to see this drug back on the market. I think chemical abortion does great harms to women and their unborn children. We certainly shouldn't be putting their health in danger, no matter what. And that's what this lawsuit is really about.
I know they gave her Miffy the day before.
Back in Alexandria, Virginia, Whole Woman's Health CEO Hagstrom Miller is bracing for a ruling that takes mifepristone off the market.
I think people know that what happens in Texas doesn't stay in Texas. Some of the most progressive states in the country will face restrictions if this lawsuit is successful.
If that's the case, her clinics and OBGYNs across the country will be forced to use only misoprostol for miscarriages and early abortion care. While taking the two pills together is 99.6% effective in terminating early pregnancy, misoprostol alone, although still extremely safe, is about 80% effective.
There's more cramping, there's more bleeding, there's some nausea, there's diarrhea, and that matters, right? That matters to pregnant people. People should have access to the highest level of medical care and should be able to have the best research and the best science.
Clinic manager Shaylin Nada says her biggest concern is that women will think they have no options.
This will absolutely have an impact on the misinformation and on what people believe to be true. Finding out that that is banned could really turn a lot of people away from not only having a medication abortion, but abortion care in general.
A decision in the case could come as soon as this Friday. For the PBS NewsHour and Kaiser Health News, I'm Sarah Varney in Amarillo, Texas.